a patient operated for HENDRICKSON in Brussels, Belgium, is a part of retrospective and prospective data that we will implement in Vietnam. I have nothing to disclose. In literature, constipation rate for HENDRICKSON diseases range from 0 to 30%, and for incontinence, it ranges widely from 0 to 60%, but most of those papers were not with long-term follow-up. That's why we conducted this study in a hospital in Brussels in order to evaluate the quality of bowel function and the quality of life of patients operated for HENDRICKSON versus controls, and to investigate the rates of long-term complications comparing open swab and minimally-invasive swab, and to objectify anomalies in constipated or incontinent patients using rectal manometry. We have 58 available charts in our hospital from 1987 to 2013, and finally we could interview 45 of them. 180 controls were also collected, matched by sex and age. At interview, the mean age were around 15 years old, and totally we have 20% of cases with chromosomic syndrome. Of course, there were less MIS swab than open swab because it's a retrospective study. The chart shows the percentage of rejected segment. Operation for HENDRICKSON give few early complications. Notice that we have one case of torsion of colon in MIS group that had to be reoperated. There are few reports about twisting of colon during TAP procedure, transanal approach, but with some clinical experience seem to show that ischemic stenosis is a quite more important problem. This slide shows the length of follow-up. Of course, the one of open swab is longer than the MIS swab. As short-term result, constipation rate were more frequent than incontinence, Over the time, in long-term outcome, you can see the rate of constipation were decreased dramatically. On the other hand, incontinence remained a big problem. Comparing to controls, the constipation rates in operative group were quite higher, but statistically, the difference between two groups were at the limit of significance. It seemed to show that the constipation in Belgium population is quite higher in 3% in literature. For fecal continence, the difference between operative and control group was highly significant. This slide shows there were no difference between two operative groups about continence. Of course, the groups are small. Considering the quality of life, the general score of operative patients were quite good, but significantly less than control score. Obviously, it's probably due to some severe incontinent patient, as you can see. All patients had constipation or incontinence problem during interview have been submitted to the rectal manometry, and the results show that some constipation patients, it could be due to additional defecation. For incontinence, probably due to destruction of the sphincter during operation, or sometimes it could be a false incontinence. And we have 7 cases got better in 15 patients with medical management. In conclusion, incontinence and constipation have been probably underestimated. If constipation is a socially acceptable situation for most of cases, incontinence have to be actively treated. And we found that there are no difference between TAP and blood tap procedure that need a randomized study that we began recently. Finally, a long-term and multidisciplinary follow-up is necessary. Thank you for your attention.
Any questions?
Any comment or question? Do you have one case of bowel twist
during pull-through. What kind of technique was used at that moment, and what kind of technique was used for the redo procedure?
Thank you for your questions. The twist of colon when lowering the colon is one of the most concern in our project to study more about that. And recently we began a prospective study randomized to compare to evaluate this problem. And the twist of the case with twist of colon in our report here in transanal approach. And I would like to invite Professor Steyak from Belgium speak more about these cases.
Effectively, the twist was a tapped only this dilatory operation, and it was converted. After that, we had to reoperate, and it was a Swenson operation. We ended laparoscopically to Swenson operation.
Thank you very much.
Thank you.
Thank you.